So a lot of people complain of sagging on the upper eyelid and also the wrinkly and skin under here and sometimes fat pads. Those are also common complaints. We often can do a lot of these procedures without doing the old cutting blepharoplasty. That is, in the old days we used to always take out skin right in here, and in the old days we used to cut along here and take out skin. So nowadays a lot of procedures can be done non-invasively. That is, we can laser up in here and that takes up some of the tightening. Now somebody who has severe skin dropping, then we do have to do some surgery. Down in here, often the fat pads can be taken out from the inside, so there's no incisions. The outside can be lasered, or we have this new procedure called face tight, where we just through a needle in here, we can actually soften some of the bulgy fat pads under here, or the eye bags, and we can also tighten the skin. So those are alternatives. Now the other way that we sometimes do for people who have prominent fat pads is we've developed a new technique. In fact, we just submitted this article for publication, and we've had an experience for about 10 years where we take the fat that's over here that's bulgy and we move it over. And our innovation is that we put it up in an area where it just takes better, the fat is more permanent, and we've had good success with our technique of it's really called a transconjunctival blepharoplasty. So it's good for the fat pads, it's good for the festoons, which is this extra skin here, and then the upper eyelids we can do a variety of different ways. So for anybody who has complaints of either the upper eyelid sagging or the bagginess and the wrinkled skin here, we have a lot of different ways of doing it, and they're probably a lot easier than anyone could imagine.